Let's move to working group number 2.
Le groupe de travail numéro 2 qui
Working group number 2 towards sustainable food and nutrition. It's a great topic, and my first 2 guests are Babette Simon
et Martin-Prével. Bonjour.
And Yves Martin-Prével.
Je vous laisse vous installer.
Merci.
Alors, Babette Simon, vous êtes professeure
Babette Simon, you're associate professor at the Health School of the University of Paris. If you are manager at the Research and Development Institute.
Je vais vous donner en premier la parole, Babette, et puis ensuite Martin-Prével, pour nous présenter un petit peu les enjeux.
Okay, Babette, first of all, what is at stake and how will you work?
D'accord. The health of our planet has sharply declined the last decades. And this is due to loss of biodiversity, climate change, and pollution. And this is a major threat for our health. And a major factor or a major driver of this changes is the food and nutrition sector. So, and that's why we choose that topic for the International Working Group 2, where we look at the food system, better nutrition, food waste management, and where we also focus on the impact the food system has on the environment. For example, agriculture, what is the agriculture doing to the environment? And the third group will look for the impact we have on humans, for example, antimicrobial resistance or the chemicals which we sometimes unfortunately eat. And the fourth theme will deal with fair commercial and financing. So, and the major challenges we are facing in the future is, first of all, we have no time. The food system is one of the major reasons why we are already living outside our planetary boundaries. So, and just to make that clear, so the food sector is reducing biodiversity and is responsible for 1/4 of all man-made greenhouse gas emissions. And the second very, very important challenge is the growing population. We are going to have, that is projected to increase about 60% the population until 2050, and we have to feed them. And that might go along with also changes in our way we are in the food system, hopefully. And the third big challenge is malnutrition. And we have 1.9 billion people which are overweight. And we do have also about 40 million which are underweight. But today it is unfortunately so that many more people consume low diet, low quality food. Mm-hmm. So that means high fat, high sugar, and a lot of salt, so energy dense food and highly processed. And that leads then to obesity or diseases like diabetes, coronary heart disease, stroke, and so on. I think these are the major challenges we have to face. And so you see, it's a very complex topic, and we are going to address that in a multifaceted way, in a systemic approach. And we are all part of the food system, so we have to find all together a way to solve that problem, to find new ways, and to find also or define concrete actions to transform our world's food system. Just in a small roundup, it's much more complex.
Yes,
but just to get an idea what we are planning to do there.
C'est un vaste programme que vous venez d'exposer. Merci.
It's a great program. Thank you very much, Babette Simon, Associate Professor at the Paris Health Faculty, how to feed the world population without impacting the environment, how to avoid malnutrition, and how to avoid illnesses linked to malnutrition like diabetes. Yves Martin-Prével from IRD. How will you seize all those topics? Well, we have a lot of work, and as a research institute, our role is to accompany, to help people understand what we need to understand is that the system is not working. Sometimes we have illnesses because of too much of something or because of not too much of the same thing. That means that there is something that is not working, and this is why a third of the people in the world is not eating properly. That is the proof that we cannot go on thinking in the same way. It's not a matter of production. It's not techniques and innovation that will lead us to producing more. Well, no, we have to respect the limit of the planet and we have to think differently. And this is why it is difficult. If we want to have one health, it's not changing the paradigm. It's just changing the way it's just changing the system. There is a world system, there is a local system, and okay, if it's local, it's better, it has less of an impact. Well, it's not necessarily the case. We need indicators, and we need to understand the impact of those food systems on the planet. And at the same time, we need to understand its impact on both people and the environment at all levels. Systems can be totally different, but they have one thing in common, is that at the heart of their working, there are people that will be more powerful than others, and who will be able to impose their point of view. So if we understand better how it works, it it will be easier to understand how the systems work, how to dialogue with everyone, and to bring answers that are acceptable to all actors. We're all in the same boat. If we don't want the boat to sink, we have to row together. Okay, we don't have much choice. We have to seize that topic. Thank you very much, Yves Martin-Prével. I have a video to show you from Action Against Hunger. In northern Cameroon, we have launched an agricultural training program to transmit a practical agroecological approach and avoid the use of pesticides. My name is Mohamedou Isma. I'm a group moderator, which means I'm the link between Action Against Hunger and my group. I am trained, and then I train the folks in my group. We grow sorgho, mainly, peanuts, enyebe, and corn. We have learned several techniques, for instance, compost preparation. The group also prepares biopesticides with grains to fight against devastating bugs. More than 4.9 million people face food insecurity in Cameroon. With this program, we are bringing a sustainable solution to farmers. This agricultural training program is an opportunity to share ideas and experience. We first paid dues, and then our crops fed us, and when we produced more than we needed, we were able to sell. The program has trained more than 700 participants, and in parallel, we lead activities to improve early tracking of malnutrition. Action Against Hunger is more than feeding.
D'action contre la faim. Pascal Revault, vous êtes le
Pascal Revault, you're the expert director for Action Against Hunger.
Les enjeux qu'il y a face à la malnutrition.
We saw in this report what is at stake with regards to malnutrition. Concretely, what will you do in your working group? Well, first of all, we help children suffering from acute malnutrition. It's difficult. There are 15 million children who risk dying in the world. 47 million suffer from acute malnutrition, and 144 million are late in their growth and their psychomotor development and social development. So first of all, we need a treatment that is adapted. And secondly, we need to reinforce the health systems and not treat the malnutrition challenge in an isolated way. There is probably a state of malnutrition that is not dealt with today, is the stunting. It's a great challenge, and we need to work with researchers. We have also to work with regards to the development of surveillance and to understand the waterbeds, to understand the trees, and to see how this impacts health in general. As you saw in the movie, we are trying to work with the transformation of agro-food systems in order, through advocacy, to suggest a change in our food system. We have indeed 10 years before we can cross those 9 fences as defined by Johanna Nordström. And when we change the food system, we can actually start pushing against, leaning against those 9 burrs. We have to work with ecosystems, not against ecosystems. Thank you, Pascal Revault. You're the Advocacy and Expert Director of Action Against Hunger. We have to be efficient in the next 10 years. We have to find a system that is working with ecosystems. Mamane, Zeilani, you are the Technical Director of Nutriset. Please tell us more about Nutriset and how it is helping in the field. Nutriset is a company in Normandy, near Rouen. It is a group. We have partners in different countries around the world. 15 years ago, we invented a product called Plumpy Nut. It helps children suffering from malnutrition, and now we have government programs that are using this product. My team and I have found solutions to prevent malnutrition. It is important to have a proper nutrition in order to be healthy, to grow in a healthy way, and to learn efficiently at school. I'll show you a video, but globally we are transferring our technology, our skills, our know-how to our partners where there is high malnutrition and where they need us. So we are partners to develop new initiatives. The reason we joined one Sustainable Health program, forum, and this is where I agree with Pascal, is that in order to go from a clinically validated project, we do not necessarily find the appropriate program. So we need, I believe, such a platform to have researchers, to have public and private partners, to generate a momentum and to approach health globally. Thank you, Mamane Zeilani. You are talking about a report. Well, this is it.
When Michel
Lescan founded Nutriset in 1986, his objective was to feed children. Today, that objective has become a mandate to fight undernourishment in the world. Such a fight means having the best nutritional solutions to meet a given challenge, be it at the world or local level. It also means having an impact on the economic development of the countries we are trying to help. It is why we developed the Plumpy Feed network. We are not a multinational set up in every country, but a local partnership able to bring a nutritional solution accompanying local authorities to meet closely the needs of children and their mothers. It gives us the opportunity to take part in the development of local agriculture, to reduce our environmental impact and increase our economic and development impact. Nutriset deals with malnutrition in the world through strong partnerships with the UN, UNICEF, WFP, and NGOs like ACF or MSF, or with local governments. But it also deals with the older people, the malnutrition of older people, or of people with specific illnesses. We believe this initiative will help us defend our convictions. Nutrition is not a branch between agriculture and health. It must be part of a health system. Nutriset is proud to be a member of this initiative.
Merci beaucoup.
Thank you very much, gentlemen, for this working group number 2.
Au sein de Nutriset et au sein d'Action contre la faim, donc Pascal Revault, expertise et plaidoyer d'Action contre la faim, et Mamane Zeilani, externe chez Nutriset. Et vous allez donc travailler, je rappelle les noms de nos précédents invités, with
Babette Simon and Yves Martin-Prével.
Autour de cette alimentation et cette nutrition durable. Merci beaucoup. Nous allons maintenant passer.
Thank you very much.